Hey y'all, welcome back to talking about hemispheres. We have talked about things like lateralization, localization, decusation, basically how our hemispheres interact with one another. Now we're going to talk about what happens when our hemispheres can't interact with one another. So we're going to talk about that in the context of split brain patients. So when we say split brain patient, we mean that the corpus callosum is severed. It's essentially cut. Why would anybody want to do something that sounds so incredibly whoa? Um, Tumors, epilepsy, a lot of it has to do with epilepsy. And as much as this can be sort of a strange procedure to think about, it actually, these patients can tell us a lot about different things. They can tell us about how information is transferred, sensory information. It can tell us about emotions. It can tell us about motor coordination, and specifically how and if any of these things um, sort of exist independently in one hemisphere or another, or do the hemispheres themselves exist independently of one another, and how do they do that? Okay. There have been some pretty clever experiments designed to examine questions about information transfer in specific. So let's look at one of these experiments. I'm just going to generally sort of give you an idea of it, and then we're going to watch a video done by Dr. Michael Gazzaniga. He is like the guy, excuse me, when it comes to split brain patient research. So we have our handy dandy model here of the visual system, and I told you about how we have um, left visual field feeds to the right part of the brain, right hemisphere, I'm sorry, right visual field feeds to the left hemisphere. Okay, so what happens now? We have a cup shown in the right visual field. Okay, so we're just dealing with the right visual field here. And we're going to show this cup to someone in their right visual field. And what's going to happen, right? So you have this cup information comes from the left eye and the right eye, and then it gets transferred over to this part of the occipital lobe. It's the left side. And what else is on the left side of the brain? Temporal lobe, language. So, primarily language for the most part. Okay, so you have a cup shown in the right visual field, and then the experimenter asks, "What did you see?" And the patient says, "I saw a cup." Okay, good. We have the visual information being fed into the part of the visual field that feeds to the part of the brain that has our language information in it. They're able to label the cup. So, what happens in the next part of the experiment? We'll do the same thing again, but now we are working with the left visual field, and we're going to show them a spoon, put the spoon in the left visual field, and the experimenter asks, "What did you see?" And the patient says, "I don't know. I mean, there was something, but I have no idea. Like, I don't know." Does the patient actually know what they saw? So why are they saying, "I don't know," right? So you've got information from the left visual field coming into both eyes, okay, and gets transferred from the left eye, from the right eye, and then it comes over to the right occipital lobe, right? Right side visual cortex. It's on the side of the brain that is not directly connected to language, typically. So the patient saw this spoon, okay, but they didn't recognize it. They don't know what it is. They have no way of expressing what it is that they saw. So let's do part 3. Spoon again. Experimenter says, "What did you see?" Patient says, "I don't know." Then the experimenter gives a patient a bag, okay, and it's just like a paper bag, whatever. It's full of different objects, okay, and one of those objects is a spoon. The experimenter says, "Okay, find the object that you saw." Patient pulls out the spoon. Why Do they pull out the spoon? Remember when we were talking about those agnosias, aperceptive agnosia, and associative agnosia, and we were talking about how visual perception can be sort of assisted when you use things like motion cues or tactile cues to sort of help visual perception succeed. This is the same thing. The patient was using their tactile knowledge, okay, and their tactile knowledge, working with, both hands, they're able to pull out a spoon. Especially, let's say they're right-handed. So now they have their right hand in a bag. Their right hand is getting all this tactile information, and it's being fed to somatosensory cortex on the left side of the brain, right? And this is where the language is. So the patient is immediately able to say, hey, I saw a spoon. Well, they're not able to say that they saw the spoon, but the tactile information is able to let them label what it is that they saw, and they can therefore pull the spoon out. All right. Let's see this in practice. Gazzaniga is the man. This lovely looking fellow right here is Gazzaniga, and this guy is Alan Alda, I forget his name. He's doing a documentary, and he will be watching some of Gazzaniga's experiments. Okay, it's pretty neat. Just 10-minute video. Enjoy. Or don't, because apparently it's not working. So, let's try this. I was trying to get all fancy, embedding things. That's what I get. All right, here you go. Enjoy.
We began our journey into the human brain here on the campus of Dartmouth College in New Hampshire. I'd come to meet one of the world's leading brain scientists, Mike Gazzaniga, and a man he's worked with for over a decade. A man with two brains. You've been working a long time with Dr. Gazzaniga?
14 or 15 years.
It doesn't seem like that long, does it?
The collaboration began when Joe had surgery. And you had this procedure to correct an epileptic problem,
yes.
Is that right?
Trying to stop the seizures. I was having seizures like every day or so, or sometimes 2 or 3 a day.
To control Joe's epileptic seizures, a surgeon severed the connection between the two halves of his brain. Cutting the corpus callosum like this prevented the spread of the electric storms that caused his seizures. But it also prevented the left and right halves of his brain from communicating with each other. In the years since the operation, Joe's epilepsy has been under control. He now earns a living at an egg farm, and in his everyday life, he's largely unaffected by the fact that his left and his right brains work independently. Do you feel any different when you think about something than you did, any differently from the way you felt before the procedure?
It's just got a backup brain, that's all.
That's something everybody could use, right? I found out how true that was right away when I was asked to draw a different shape with each hand. In a brain like mine, roughly speaking normal, at least all in one piece, the left half of my brain controls the right side of my body, while the right brain controls the left side.
Oh, no.
But because the two halves are connected,
Nothing wrong with that.
getting each hand to work independently isn't easy.
Well, we're seeing the fact that Alan's hemispheres are connected. And that the motor messages from one are confusing the motor messages in the other.
I was just drawing an upside-down duck.
Okay.
But when Joe is given the same task, his two hands operate as if controlled by two separate brains. What's happening is that each half of Joe's brain is given a separate instruction. He's asked to fix his eyes on the cross in the center of the screen. Anything flashed to the right of the cross goes only to his left hemisphere. Things to the left go to his right hemisphere. Because the two don't communicate, each hand does only what its half of the brain sees.
Wow, look at that. It's really like two different people doing the same.
That's right.
Same task.
That's the idea.
Okay, Joe, I want you to keep your hands out in front
In
of
an
you.
experiment that's now a classic in brain research, Mike Gazzaniga over 30 years ago used a similar setup to find out if the two halves of the brain are specialized to do different things.
Ship.
Joe is being flashed a word only to one half of his brain. Words flashed to the right
Storm.
are seen only by his left brain, and Joe can report seeing those words just fine.
Piano. Good.
But when a word is flashed to his right brain,
Didn't see that. Okay. Joe, I'm going to ask you
but now watch what happens.
to draw that with your left hand. You're going to be lost. Why don't you try drawing another picture of it over here if that'll help you. Oh, phone. Oh, okay.
It's almost as though somebody has given him a secret communication.
That's
And
right.
now he knows that it's a telephone. But up until then, he was blind to it.
Exactly.
When Gazzaniga first did this experiment, it instantly proved that the ability to speak resides almost exclusively in the left hemisphere. Not until he sees what his right brain is drawing is Joe able to name
He
it.
said church, didn't he?
After looking at the picture.
But he had to figure it out about as long as we did. That's really interesting. It's a picture here of somebody communicating almost with another person.
The communication is not occurring inside the head, it's occurring out on the piece of paper.
Yeah.
Blob. I really don't know. You want to draw a little bit more?
So far, Joe has been seeing only one word.
Cat. That's a cat
Things get
sound.
even stranger when he's flashed two words, each to only one half of his brain.
The right hemisphere saw toad.
Yeah.
And so his left hand draws a toad.
So there's the toad.
Oh, it's a toad. Right.
And this time I was able to guess what was coming.
Will we put a little three-legged stool in there later, or what?
Joe's speaking left brain saw a stool. Saying the word lets the hand that's controlled by his right brain in on the secret.
That's great. That's really interesting. And if he had seen that with the corpus callosum intact, he would have drawn a toadstool.
Right.
Not a toad and a stool.
Right, exactly the point. I've been doing this for 35 years. Yeah.
And
It gets me every time.
Yeah, it must. It must.
This time, instead of naming the word, I want you to point to the word.
Again, Joe sees two words simultaneously. Bell goes to his non-speaking right brain. Music to his speaking left brain. When asked to point to a picture of what he saw, he chooses Bell. But when asked why,
Okay, why'd you pick that one? Music. Music?
and when asked to explain,
It was music, bell, and those few minutes ago, last time I heard any music was coming from the bells out here, banging away. So the bells outside here? So, a good enough answer to me.
what's extraordinary is that Joe's speaking left brain concocts a plausible story of why he pointed to Bell, even when some of the other pictures more obviously represent music. Gazzaniga believes this determination to find cause and effect, this desire to explain, is the left hemisphere's most marvelous property.
One of the unique things of the human brain is this need to interpret why two events occurred. What was the antecedent of this? What caused this? And if you can imagine that a species like us that has that little chip in its brain that asks those questions is going to survive rather well, because it's going to figure out more about the nature of the world than a species that doesn't have that.
Okay, Joe, I want you to keep your hand.
But as I was about to discover, the right brain has a very useful survival skill all its own.
What do you think will happen here?
So for you, we're doing a live experiment. Never done it before.
The experiment involves the 16th century Italian painter Arcimboldo, who made faces out of fruit, flowers, meat, even books. From other research, there's reason to believe that the ability to recognize faces is located exclusively in the right hemisphere. So Mike wondered if Arcimboldo's paintings would look different to each of Joe's two brains.
So will his left hemisphere say, I saw a potato. I didn't see a face. And will his right hemisphere say, I saw the face, and not comment on the fact it was made out of a potato?
You're going to see a figure followed by a choice of 2 words.
If this works, it'll be terrific, but we'll see. So here it is, live.
Okay?
The first painting goes to the right hemisphere. And Joe points to face. The next painting goes to his left brain. And this time he points to fruits. Mike seemed pleased. Are you having a moment?
This is too good.
Again to the right brain, and Joe sees it as a face.
Point it down.
But to the left brain,
Face made out of books.
Point it up.
What are the books?
were you happy with what you're
Fruit.
seeing?
It's unbelievable. He's doing it. You see that?
It's good. They're going so fast. It's shifting from left to right so fast. I can't keep up with you. You're used to looking at this.
When you show him a face in the right side, the left hemisphere,
Yeah.
he's focusing in on the elements that made up the face.
Yeah.
When you show him the exact same picture in the left field, going to the right hemisphere, he's focusing on the face and not the elements.
And not the elements. If you came down from another planet and you saw faces and vegetables, you might not think there was much of a difference among them. But the brain seems to be made up in a certain way to say faces are very different from other objects.
That's right.
And one side of the brain specializes in faces.
Exactly right. Exactly right. It is an adaptation that we have to detect upright faces. It's a very important. You can imagine in an evolutionary time that all of a sudden you have the ability to detect quickly an upright face. You want to read the expression on that face. You want to know if it's friend or foe. You want to have a set of questions about that face.
The right brain might be skilled at recognizing faces. But when it comes to what gives the human mind its power, the ability to reason, to invent, to interpret the world around it, Mike Gazaniga's 30 years of research has taught him which hemisphere he wouldn't want to be without.
The old phrase around our lab is don't leave home without your left hemisphere. That's where the action is.
Okay. Good stuff. Let's get back to business here. Of course it works now, guys. Of course. Anyway, so where are we here? Let me pull everything back up to where we need to be. Okay, so this is patient PS. It's another split brain patient. And basically this patient has language information, some language information in both hemispheres. Okay, and this does happen. Now let's see how this works. So essentially we present the emotionally charged words to the left hemisphere, right? So you're going to show it in the right visual field. Show an emotionally charged word, devil. Was the word good or bad? Patient says bad, okay? She judges it to be bad. What was the word? I saw the word devil, right? So we have right visual field information going to the left side of the brain. This is where the language is. She's able to make the label for the word, and she's able to process some deeper semantic meaning of the word, right? Whether or not it's valenced as good or bad. Okay. Now let's move on to part 2. We've got left hemisphere. We are going to do the same kind of thing. We're going to show them the word devil to the left hemisphere. Was the word good or bad? Patient says it's bad. What was the word? Patient says, I don't know. So we have left visual field feeding to right hemisphere. There's purportedly, for most, on average, no language information, or not much language information going on the right side of the brain. But she gets some language information here, right? I don't know why patient PS is a she to me. So she sees devil with her right hemisphere, and she is able to access that deep semantic content about how the word is valenced, if it's a good or a bad word. But she's not able to reach the label, and the label information would most likely be in the left hemisphere. So now we don't really know what's going on here. Is it that she has semantic information that's processed in the right information? Does she in the right hemisphere? Does she have actual semantic information here, or is there somehow some semantic information that's being transferred to the left or from the left to the right? We don't, I mean, obviously the left and right hemispheres aren't connected, right? But we also understand, like Gazzaniga said, that the hemispheres can't communicate with one another. They're just not doing it inside your head, they're doing it outside of your head. So we assume that there must be some semantic information stored here, but we can't leave out the possibility that somehow it's sent from the left side of the brain. Okay. Another phenomenon stemming from split brain is what we call alien hand phenomenon. Okay, now this was studied by Kurt Goldstein, very well-known neurologist. And no, this does not involve development of extraterrestrial limbs, but it is very fascinating. So it has to do with a middle-aged woman, okay, and she had suicidal tendencies, and she would try to strangle herself with her left hand. She would be fighting her left hand off with her right hand. So it's essentially like there were two people fighting each other, one with each of her hands. Okay, each one with one of her hands. Now, her autopsy after she passed did reveal a corpus callosum lesion. So some kind of brain damage somehow, somewhere, leading to corpus callosum damage. We do know that the right hemisphere can be slightly more emotional. Maybe she was trying to commit suicide with her suicidal tendencies, right? And the left hemisphere was not aware of this particular intention, right? So she has a depressed side of her brain and a non-depressed side of her brain, okay? So let's look at, if I can get it to work, an actual demonstration of alien hand syndrome.
Das Mähne sagt du, gell? Da lebt er da los. Da sagt er, da will er los. Wat is met die naam toch gebeurd? Ja, maar hoe zijn die toch mogelijk? Zeg, zie je? Zeg je dat alweer kapot? Ik kan nogal niet mijn neusjes snijden.
Right, so there is some
Kan niemand een keer met schoen voeren?
poor thing. There's some communication between the hemispheres that's not taking place, such that the conscious part of the brain is not aware of what this unconscious part of the brain is trying to do, right? So if she's conscious of what's going on with her, it looks like she's with her. So she's got her right hand is okay. She's trying to push away the left hand, right? So she's in tune with what's going on. Left hemisphere, right hemisphere is not able to communicate with the left hemisphere what it wants to do.
Van wie is deze arm? Dan weet je dat die een arm is? Ja. Ik denk dat die van mij is, maar die gehoord aan niks.
Okay, so it's not that the patient feels like they have an alien hand, right? It's not about actual alien hands. They understand that the arm is theirs, but they just don't understand the will of the arm, right? The intent of the arm to do what they needed to do. Um, so what does this say? This is pretty good, like, interaction topics, right? What does it say about the will? What does it say about the self? Are there two of us? Do we even need the other half of our brain? Like, do we have to have these two hemispheres? Is this just all part of nature's redundancy plan? Is this, is it really necessary anymore? Can we, like, harness the there's a lot of theoretical implications here, right? So ask yourself these questions, think about these questions, maybe relate them to your readings, and come up with some great interactions. Ask me questions if you have them, and I will see you in the next lecture topic.